Good morning, everyone, and welcome. My name is Rachel Browner. I am the program coordinator for OneOp, the Lifespan Caregiving Group, and it's my pleasure to welcome you to today's session on supporting military families, an in-depth look at TRICARE Autism Care Demonstration. In case you're joining us for the first time, I'd like to just give you a brief tour of our webinar platform so you can find your way around. Hopefully you're currently able to view the slides that we're sharing. If you are unable to see them or if you have any other difficulties, please email us at contact@oneop.org for tech support, and I'll place that email here in the chat momentarily. As some of you've already done, we look forward to having you join us in that chat pod for conversations and questions. I've already enjoyed seeing where everyone's joining us from. I've noticed several folks from Texas, California, Utah, Iowa. It's great to see folks from all over continue posting in that chat where you're joining us from. And for those of you that you're having trouble with that chat, to embed the chat pod so you don't miss any links or conversations, simply place your cursor over the shared slides. You'll then see a toolbar pop up across the bottom of your screen. From there, just click the chat bubble icon. And so when typing any questions or comments, please be sure to select that everyone from the response options drop-down menu so everyone's able to view your questions or comments in that chat. So again, love seeing everyone popping in the chat now, letting us know where you're joining us from. Sharon, welcome from Germany. Thank you for being on. Um, Note that the slides and resources are available for download on the event page for today's session. We're going to be covering continuing education information. We're going to offer lots of CE opportunities, but we're going to cover all of that at the very end of the webinar. So please stay tuned at the end if you are interested in CE credits or just a general certificate of attendance. And finally, closed captioning is available for this webinar, so you can turn on the subtitles via that Zoom toolbar. And I just want to give a shout out. Thank you for joining us as we continue our partnership with the Department of Defense and the U.S. Department of Agriculture to expand the readiness, knowledge, and networks of the professionals supporting our military service members and their families. Please note the views expressed in this presentation do not necessarily reflect the official policy of the Department of Defense, U.S. Department of Agriculture, and the U.S. government, or OneOp. The mention of any entity or product is for informational purposes only. At this time, I'd like to introduce our presenter for today. We're really excited to have Dr. Biena, who is a clinical psychologist and senior policy analyst for the Defense Health Agency, presenting, and she's with the Medical Affairs Directorate in Falls Church, Virginia. Dr. Biena serves as the DHA lead for the complex pediatric clinical community and is the clinical program lead supporting the TRICARE health plans for the rapidly evolving autism care demonstration, where she implements clinical expertise in program development and oversight for a program that really significantly impacts overall military readiness. Dr. Biena has over 20 years of experience working directly with beneficiaries diagnosed with autism spectrum disorder, as well as their families and other healthcare providers. She is not new to our OneOp community. She's regularly provides annual webinars for our community, and we're so excited to have her back and joining for us. Um, if you have any questions or comments throughout today's session, please post them in the chat and we'll try and get to them as best as we can. Without further ado, Dr. Biena.
Hi, I couldn't get off mute. My apologies. Thank you very much for having me. I am so excited to be here. Obviously, as said, I'm going to be talking about the autism care demonstration. I want to start with a little disclaimer. Um, it is my understanding that most of you all on the call today are generally working with families in some capacity, whether it's through the MTF or maybe EFMP. I saw some folks in your signature blocks where you might be associate what organization or what department maybe you're affiliated with. My hope is to share information about the policy and key things that you may get asked, or maybe you've heard about, or things that families have already asked you. My goal is to talk about those um, components of the program that are probably where you're involved, and then offer you some talking points or maybe some clarity in some sections. So that's my goal. My disclaimer is that I can't address any specific beneficiary issues. So if you think of a family and maybe who's particularly struggling, or if they have a unique question, I would encourage you to have the family reach out to the managed care support contractor, the respective managed care support contractor for immediate assistance. I certainly can facilitate like themes of questions, but individual beneficiary questions I won't be able to answer here today. My overview is that I'm going to hit up the entire program from beginning to end, um, give and then close out with some resources for everybody. And I'll leave the last, hopefully, significant portion of time to answer any questions that come in through the chat. So let's start with what is the program and what does TRICARE offer? So many of you, I hope, are familiar with the TRICARE Basic Program, which is the statutorily defined medical program for coverage of military beneficiaries. What I have listed here on the right side are common services that individuals and their families who have an autism diagnosis, what they may commonly access, especially at first diagnosis, and maybe some initial referrals. So you'll see things like speech, occupational therapy, physical therapy, medication management, sometimes psychological services. These are just a few. They're definitely not all inclusive. But why this is important is that the basic program is one authority, and there are several other programs that have different authorities for coverage. I won't necessarily talk about here, but things like the ECHO program, the Extended Care Health Option, pharmacy, dental, those are other programs that are under different authorities that are not the TRICARE basic benefit, but there is some authority for coverage. Um, oh, I went too quick. So let's talk about the authority for the autism care demonstration. So it is separate from the TRICARE basic benefit. It is an authority that we're operating under since 2014. The current demonstration as written is authorized through December 31st, 2028. So it's a few years away, but it's going to come quick. I don't know what beyond 2028 looks like. There are a lot of things going on. Some folks may be aware that the National Academies of Sciences, Engineering, and Medicine is doing an independent analysis, and one of their charges is to come up with some recommendations. So we're going to look to that report, which hopefully will come out by the end of the year. But about the ACD in its current state, for those eligible to participate, there are no limits to the benefit, meaning we don't have an age cap, we don't have a dollar cap, we don't have a how long you've been in the program cap, but the caveat there is they all need to be clinically necessary and appropriate services. And that's important because I think folks may have exposure to behavior analytic principles being applied in a variety of settings. So schools oftentimes have some ABA programs, although they look different state to state, county to county. There may be other places where behavior analytic services can be implemented, things like on the job, vocational training and skills. So what TRICARE covers is those that are clinically necessary and appropriate for the diagnosis of autism spectrum disorder. Another key point is ABA under the military health system is only available in the private sector, so you won't find ABA in the MTFs, right, the military medical treatment facilities. And then the last piece that I think is unique, and we'll talk about multiple times throughout my presentation, is the implementation of these autism services navigators. Those folks are specialized care managers. Every beneficiary under the ACD gets assigned an ASN. So it's a unique role under the ACD. I go to my next slide. I'm assuming that most folks are familiar with ABA. I don't want to belabor it too much. If you do, I could talk to you for hours about what it is and what it looks like and how it might be applied to kids across, well, kids, young adults, across the spectrum. But the very, very, very brief version to share is that the behavior analytic principles are really based on science and of in the principles of learning and behavior, and really how behavior can be affected throughout the lifespan, through day to day, throughout the lifespan, and what external and internal things can affect that behavior. Again, that was a very Cliff Notes version of the definition, but I think that's sufficient for today. Um, where the ACD is authorizing ABA that will is looking to produce meaningful change in the behavior of the participants in the program. ABA is um, managed by the licensed or certified behavior analyst. I'm going to talk about provider qualifications on the next slide. But they're focusing on the individual's treatment and in their specific environment. And then the last one, again, you'll hear me say throughout the presentation, and I hope you repeat this in every conversation that you have with families, is that family members and the other individuals in their lives, I have caregivers because I'm not sure how wide of a reach all families might have, but it's not just the individual patient. This is a system application. So we're not asking families to be therapists. We're asking them to be the extender of those mastered skills that can be applied in every moment throughout the day, throughout the lifespan. So I mentioned about ABA providers. I'll start with actually the bottom half. So there are three tiers of ABA providers. The that TRICARE recognizes and throughout the industry, but the authorized ABA supervisor is generally the board certified behavior analyst who has a master's or sometimes a doctorate in, usually it's behavior analysis, but sometimes they may be psychologists who have behavior analytic training. Those are the people that are authorized to oversee the care in under the ACD. They're supported by two levels of providers, the assistant behavior analyst, who is generally has a bachelor's degree in some relevant field, who is working under the direct supervision of the board certified behavior analyst. And then much of the direct care delivery time is delivered by a behavior technician. Both the assistant and the BT are supervised for their work. They cannot function independently, so you will always have a supervisor. Um, a lot of the many of our beneficiaries engage in what is the tiered model. Now I'm going back to the top. There are two models of service delivery. The tiered model is when you have all three levels of providers participating or delivering the care. And then the sole provider model is generally just the BCBA level, the master's level person rendering care. If I go to my next slide, let's talk about eligibility. So um, to access the autism care demonstration, you must be a TRICARE eligible beneficiary enrolled in an eligible plan. So that could be an active duty service member's dependent enrolled in Prime or Select. You could be a retiree family member who is accessing the ACD, again, enrolled in Prime or Select. There are other plan options like TRICARE Young Adult, TRICARE Reserve Select. Those other plans are the eligible plan options. I just happen to know the data that the vast majority are active duty family members enrolled in Prime. But again, Select and retiree families and the other eligible plan types are eligible. There must be a definitive diagnosis of autism, so an authorized provider will see the patient. So oftentimes it's primary care. I would say that we have equal number of specialty care providers providing the diagnosis. So your developmental behavioral pediatrician, your psychologist. Those are the TOM describes all of the eligible provider types, but those are generally the top three that render the diagnosis. The age piece there, a lot of kids are getting diagnosed 3, 4, 5 years old. Obviously, we're working hard to get our providers to identify kids earlier. The whole philosophy behind ABA is early intensive intervention. So we don't want to miss out on prime months and years if identified early enough. But some kids are diagnosed a little bit later. And for those diagnosed for the first time at age 8 or later, the requirement under the policy is that they're identified by a specialized autism spectrum disorder diagnosing provider. And really, that's because if at age 8 is the first time that it's been diagnosed, I'm imagining there's much more of a differential diagnosis happening. So the specialist is really primed to do that the best. Okay, so following a diagnosis, a referral will be submitted, and that referral includes that supporting documentation from that diagnostic appointment. So the DSM-5 checklist, those are what are the symptom presentation of that individual at the time, and then a recurring requirement. And then the validated assessment tool, which happens at that diagnostic appointment. And really that's supporting information for the diagnosing provider of symptom presentation. Because if you think about it, the provider has sometimes 30 minutes, maybe an hour, maybe there's at the psychologist and have a couple of hours to do some assessments. But that validated assessment tool is supporting documentation to the provider to help confirm and support that autism diagnosis. The other piece about the active duty service members, their family members must be enrolled in EFMP and registered in ECHO. EFMP enrollment is a service requirement, not a healthcare requirement, but it is a service piece that the ACD recognizes. And then registration in ECHO is I could go on for ECHO, but I'll just do the blurb here, is that ECHO registration provides access to an extensive range of services that active duty families can access. Things like incontinence supplies, respite care, speech and OT beyond the medical benefit. So there are extra bonus things that are available to those active duty families. The non-active duty families or the retirees, they generally have access to those Medicaid services, which are supposed to parallel some of these ECHO services. But yeah, moving to the next slide. So accessing care. So once that referral has been submitted, the contractor reviews and ensures that all of those required elements are present. Once that is met, an ASN, that Autism Services Navigator, gets assigned to the beneficiary, and that ASN will reach out to that family, that new family who's joining the program, to make contact, to establish a relationship, and to start some things going. I'm going to talk about the ASN's role in a few slides here. The other things I want to point out are the active provider placement, which is unique to the ACD. This is the managed care support contractor's requirement to identify a provider who agrees to take the patient and see them, their first appointment, within 28 days so of that verified referral. So the managed care support contractors are reaching out, by phone, by email, by fax. I mean, I don't know who uses fax, but nonetheless, they're making contact to confirm that the provider says, yes, I have availability to begin the assessment within 28 days. That, again, that's unique to the ACD. The piece about outcomes, I have an outcome slide, but I'll throw in here too. If outcomes aren't completed at that baseline or that diagnostic appointment, the contractors will help find or identify a provider who has the skill and capability to do that. So that might be the BCBA, it might be another authorized provider, just depends on the situation.
Dr. Beanie, we did have a question.
Sure.
What is the validated assessment tool, and is there a list of accessible or acceptable assessments?
Yes, I'll go back to that. And I don't think I have it in my backup slides here, but there are 5 validated assessment tools approved under the ACD, and they range in length and skill type, meaning a specialized provider may use a more in-depth tool, or a primary care person might use a screener. So I don't know if folks are going to be familiar with these assessment tools, but the ADOS is the gold standard for diagnostic assessment. So the Autism Diagnostic Observation Scale, that's one that you will often find the developmental pediatrician or the clinical psychologist using. I doubt that a primary care provider would be trained in something like that, but that's why we have a range. So then other tools are like the GARS, I think it's the Gilliam Autism Rating Scale. The CARS is another one. I forget what the C stands for, but it's another autism rating scale. There's the STAT, which I forget the acronym off the top of my head. And then, oh, I guess we have six, the ADIR, the Autism Diagnostic. I think I is inventory. So there are a range of tools that the diagnosing provider can use to supplement their assessment. Oh, and those are listed in the TOM, in the policy, so they're available for review. Okay. Let me see, go back. Okay, so continuing about access and care. So that authorization is going to be issued to the ABA supervisor. They're going to do the assessment, which means direct observation of the child or the beneficiary. They're going to talk with the family. They're going to do some assessment measures. Usually, oftentimes I see assessment tools like the VV map or the ABLES. Those are two common ones. They're not the only ones by any means, but those are common ABA tools to do some baseline and periodic assessments. That supervisor will develop a treatment plan. That treatment plan will be reviewed for clinical necessity. And I'll bring it back to the piece about principles of ABA can be applied across a variety of things. And so what we're authorized to reimburse are for those that treat those core symptoms, those restrictive repetitive behavior skills and the social communication skills. So the contractor reviews for clinical necessity. Once that's complete, there'll be a treatment plan authorization, and those are valid for 6 months. So every 6 months, or hopefully providers are submitting before the end of the 6 months, those treatment plans are being submitted for the next review. Okay,
We have some more questions if you
sure.
okay. Um, Retirees can still fall under ACD even though they cannot enroll in EFMP. Is that correct?
Correct.
Okay.
That's an easy one.
All right. And then another question was, does the diagnosis have to come from a developmental pediatrician or psychiatrist?
No, there are again, it's in the TOM, and I don't have that right in front of me, but there are two categories of providers. There's the primary care category and then the specialty provider category. And the primary care generally is a pediatrician, a pediatric nurse practitioner. Um, there are a couple more that are escaping me. And then the specialty provider, it could be a neurologist, a psychologist, psychiatrist, a doctor of nursing practice, the developmental behavioral pediatrician. Think I said neurologist, but there are a handful of within those two categories that are eligible providers.
Great. And as you're talking about these assessments, how long should it be from when the assessment is done with the goals identified to when treatment is actually begin occurring?
You know, that is I do not have a slide on this, so I'll talk about it now. So the goal is that the assessment should be completed within 14 days. That's in the TRICARE policy that the provider should complete all of the assessment and turn in that treatment plan pretty quickly to then execute care within the next 28 days of the cycle, right? So hopefully we're thinking no more than 2 months here. I do think there are some exceptions because sometimes providers submit for goals that aren't covered or families aren't responsive, and so it takes longer for the assessment to be completed. So there are some, like, I think logistic and administrative pieces, but ideally that treatment is beginning within 28 days of that complete approved treatment plan. I will put the plug in that I think we need to be open to what treatment might look like. I think oftentimes folks think of it as that one-on-one time with that behavior technician, and that may not be feasible as some practices don't necessarily have available behavior technicians. So they might have to go out and hire somebody. They might have to train somebody. They might have to rearrange schedules to get the hours met for the proposed treatment plan. So when we think about what treatment might look like at the start, it could be group, if that's appropriate. It's not always appropriate for everybody. It could be parent engagement, and again, not that the parent is the therapist, but what can skill development look like from the beginning? What are some initial uh, um, day-to-day skills that can be taught with the parents? And again, parents can be individual or group. It could be services rendered by the BCBA. So what treatment looks like at the beginning has a lot of factors. I just ask folks to be open about where practices are in their business and their hiring and their availability of staff.
Thank you. And we've had some folks just helping you provide resources in the chat. So I know individuals provided a list of the VATs that you
Yep.
mentioned. So I appreciate that, and approved providers. So those of you building upon Dr. Biena's um, content here. I appreciate it as you support your colleagues and peers in that chat. So I appreciate that. And Dr. Bino, one last thing. One of the things that we're seeing sometimes in the chat is the timeline that you talked about, the timeline for these autism services. Do you have any recommendations for providers as they think about um, access to care as they go through this maybe difficult timeline and switching over to TRICARE West, and any delays? Do you have any recommendations for providers as they go through this, or even family members?
Are we talking about ABA providers, or are we talking about the folks on the call here who are maybe EFMP or at the MTF, or maybe,
I
I
think
don't
the
know if I saw referral.
Yeah, EFMP level, the
Yeah,
timeline.
yeah, so I think a couple of things. One, you know, um, I think families certainly need to leverage the support that they have through the ASN. Help get that AS, if the ASN is not aware. I really hope they all are. Or maybe families have an a non-clinical support coordinator, which I didn't talk about because I forgot to include it, but be reaching out to somebody at the contractor level to help facilitate whatever the issue is, whether it's initiating care, transitioning to a new provider, transitioning with the region issues. I think that communication is key for those families, and then figuring out how to maintain something with that treatment plan. So again, whether it's the BCBA support, whether it's through the group benefit, I think it would be helpful for you all who are talking with these families to remind them that there are services and supports available.
Thank you. And we'll hold off on any more questions that are coming through, so Dr. Bina can get through some more of her content. But please know I am marking your questions, your comments that are posted. Thanks, Dr.
Great.
Bina.
Thank you. I want to spend the next two slides talking about the Autism Services Navigator because, like I mentioned, they are unique to the ACD, not unique in the concept of like a care manager or case manager, care coordinator, but really why they're unique to the ACD is that this is a dedicated point of contact for each beneficiary and their family within the program to be somebody knowledgeable about autism. Now, they are required to be at a clinical level. So again, in the TOM, it defines their requirements. But they are supposed to have a background in clinical case management. They may often have experience in pediatric or behavioral health, or even better would be autism. So their clinical background on case management and coordination of care is crucial. They're not a treating provider. They're not somebody who is going to be dictating referrals or approving or disapproving anything. They're really the belly button for the family when the family has questions. So I got this referral. I don't know what to do with it. Somebody mentioned to me that maybe this intervention would be something. Is that covered? Can I get a referral? Who's a good provider for that? This ASN really is that central point of contact to help that family navigate the healthcare system, navigate the ACD, and whatever autism related services that beneficiary might need. There are two things on here in particular that I want to highlight because I think it's one of the most best things that the ASN is offering is that the facilitating of continuity of care. So when a active duty family PCSs, or let's say a retiree family is moving, right? You're moving from, I don't know, Northern California to Arizona, or maybe from Arizona to Washington, D.C. That ASN is the person who's going to help facilitate those transfer of records for your beneficiary. So there's a requirement for an overlap of communication between the losing and the gaining contractors. So we have put in place a really prime opportunity for the family to be supported in that move. I was going to say PCS, but not everybody PCSs. So whatever the transition is, that ASN is primed to be that person. The other piece is the development of a comprehensive care plan. And I'm going to go to the next slide to talk about what a comprehensive care plan is. So it is a document that is intended to consolidate that beneficiary's healthcare activity and put it in a consolidated place. So tracking timelines, tracking things working, not working, setting goals for the family, not therapeutic goals, but things that, hey, I'm overwhelmed at the beginning. I just want to put all these things down in paper. And when we revisit this in 6 months, like let's revisit some of the other referrals or other services, or like the one on there, they're documenting the PCS timeline. So the comprehensive care plan, again, a non-clinical non-therapeutic document, is intended to be a central piece of information where all of that beneficiary participating in the ACD, all of their care and questions and referrals and important pieces are centrally housed. This is updated every 6 months. So again, the Autism Services Navigator is engaging with the family. They are providing the support, answering questions, pointing to referrals, things like that. Okay. As I move on, um, I don't have a reference at the end, but I'm going to say it now and then say it again later. It's findhelp.org is a resource available that's on both of the contractors' website that offers local level resources. I'm going to talk about that again, but I wrote it down so I wouldn't forget. Um, Outcome measures. Many folks may be tracking that the ACD requires, well, they're congressionally mandated, but we've tried to pick measures that have that's really speak to the population and the vast number of beneficiaries by age, by location, by provider skill type who can complete these measures. And so there are there are three of the outcome measures are required at periodic intervals. So at baseline, so before treatment starts, what is baseline functioning? And then periodic intervals, 6 and 12 months for the subsequent outcome measures. I don't think I have them listed here, but for folks who may be interested, the outcome measures are the Vineland Adaptive Behavior Scale, the Social Responsiveness Scale, and the PDDBI, the Pervasive Developmental Disorder Behavior Inventory. All three of those can be executed by the behavior analyst, not always, and I don't know that every BCBA seeks training on the Vineland and the SRS, but the PDD, all three measures are graded as a skill type level that can be administered by a master's level qualified individual. There are two other it's one assessment, but broken down. There are two tools broken down by ages. It's the parent stress measures. Those are not outcome measures for the purpose of ABA impact, but they are really about having a pulse on the family as a system and identifying, for those with elevated stress-related scores, identifying appropriate services for the family and the individuals, whether it's support groups, whether medication management, whether it's psychotherapy, whether it's just Another local resource. The idea for the parents' stress measures is to also support the families who are participating in the ACD. The last bullet I have there is about outcome measures being required before the next issuing of an authorization. So they're on a schedule to ensure that we have compliance going forward. I mentioned the outcome measures, but let's talk about the other ongoing requirements. So I talked about the initial, the referral, the diagnosis, the baseline outcome measures, but every 6 months, the ABA provider completes an updated treatment plan, and that gets submitted and reviewed and approved. The outcome measures are going forward. The contractor does the clinical necessity review. Again, that happens every 6 months. Annually, some outcome measures are completed. Those are the Vineland and the SRS. And then every 2 years, the beneficiary must go back to that referring provider. It could also be the same diagnosing provider, but it's, generally the provider who can refer for ongoing care. One piece to clarify, because I've heard this in the past, is that follow-up appointment is not a re-diagnosis. It is a pulse check by the medical provider on where are we with our care? Where is progress or lack of progress? Do we need to adjust any of the referrals? Do we need to add more? Look another direction, something like that. So every 2 years with that medical provider is about that comprehensive look. All right, I mentioned in the beginning about parents and families. I really want to hone in on their participation because, the top line looks a little intimidating by saying it's a requirement for parent participation. But if you really think about ABA or any treatment for that matter, it's a finite blip in time for the participant. They are living their lives outside of that intervention time. Again, whether it's speech, physical therapy, occupational therapy, or maybe some other non-medical services. Those are distinct periods of time that have a start and an end, and they go back to that family system. And so parent engagement is key, and research supports that family engagement is the extension and the long-term translation and generalization of skills. So it says requirement, but I think folks really need to understand that parents and family members are key. Resources for families. So TriWest and Humana, they have resources available on their website. This is the new to the ACD toolkit. I know it says new to the ACD, but anybody can access it. The local area supports, that's where you might see the reference to the findhelp.org is you can put in your zip code and filter by distance, by topic of interest, and it'll pull up all of the resources on that website that offer access to a service or support. So education, food and housing, medical. I think there are some like community-based resources. I'm forgetting all of the 10, but it's a great resource for folks to access. Um, the contractors also have information about what might be available on the MTF. Again, they're different MTF to MTF, so I would imagine that folks would agree that what services are available at Fort Bliss might be very different than what's available at Madigan. There are other resources available, so information about Military One Source, MWR, maybe other things that EFMP, all of those resources are connected to the contractor website. And then the last one I'll point out is a opportunity for parent-led intervention, not equivalent to or a supplement for, but could be something that, depending on where folks and families are with their treatment or maybe their diagnosis or their opportunity for engagement. Parent-mediated services are generally parent-led, not behavior technician, but like a parent-led intervention. There are a lot of common ones out there. I'm not going to name them by name because I don't want to like show favoritism. There are a handful of parent-mediated services available. Okay, I'm coming down to the end here, which is great because we have time for questions. These are some common resources that I point personnel, those who help families, but also families themselves. access to publicly available. So health.mil and TRICARE.mil both have resources available. One is a beneficiary facing, another is the, public facing or provider facing. The dha.acd@health.mil email address, that goes to me and the team here at the DHA headquarters. We can't answer, again, beneficiary specific questions because we don't have access to their health records or their contractor files, their managed care support contractor region files. But it is a place where families, providers, advocates, anybody can send us questions about the program or the policy, or if you're having issues contacting, the contractor, or you're having issues, let's say, with an MTF or something like that, we can certainly take those and route them to the appropriate office for support and resolution. The ACD fact sheet is available on the TRICARE.mil page. And then both contractors, like I've said, have the contractor website with those parent toolkits. I do have a website now for TriWest. I had to submit this prior to that go live date, so I certainly can provide that at a future time. Again, my asterisk is beneficiary questions or contractor specific questions be directed back to the contractor. Okay, good resource for families here. Parents and families, if you are engaging with families and they want a number or they want a website to go to, here are the three contractors that and their phone numbers, their dedicated ABA lines, as well as their websites. Again, you can retrieve these from the slide deck. Great to have. I would encourage every family to put them on their top 10 speed dial. And now I will open it for questions, which I hope there are many.
Well, we do have some questions for you, Dr. Biana, and some comments that have come through. So I'm going to try to get through the chat. And so if I miss something, bear with me. And if you have to retype it in the chat, feel free to do so. All right, so going down the list, is the ACN the same as the ECHO case manager for a child enrolled in EFMP and ECHO for autism services?
That was a lot of acronyms. And I can't see the chat box, so I'm going to try and repeat that. So is the case manager for the ACD, ECHO, and EFMP the same? Is that correct?
Is the ACN the same as the ECHO case manager for a child enrolled in EFMP and ECHO autism services?
Okay, thank you for clarifying. So it may be that the contractor is using the ECHO case manager, but they are under the ACD, they are the role of the ASN. So it could be somebody who's dual-hatted, but their role would extend beyond the ECHO piece. I don't know that that's happening, but it's possible that the contractor has executed it like that.
Okay. And for those in Texas that switched over to TriWest, are families to be contacted with who their new ASN is if switching, and if so, by when?
I can't comment on a timeline, but yes, the ASN should be reaching out. And I will note that prior to the T5 contract, we were phasing in the ASN uh, personnel, like the staff. So it is now everybody, as of January 1, 2025, everybody should have an ASN assigned. And if you don't know who that is, I would again recommend that the family directly contact the managed care support contractor to get that name and phone number. That it is spelled out in the policy that the family should be given in writing that the name and phone number to their designated person.
All right. Is there any advocacy we need to be aware of to ensure services continue through TRICARE? Families are only use what they are aware of and what they may need in the current environment to be ruled as underutilized, not important, aka not important if utilized is low. I'm not sure if that's an actual question, so clarify me in the chat if that was yours. Um, so self-advocacy to ensure services continue through TRICARE. All right.
Uh,
Oh,
I'm
sorry.
not, oh, go ahead.
Oh, go ahead,
I was
Dr.
going to say,
Hall.
I'm not quite sure that I understand the intent. I don't know if, again, I can't see the chat, so I'm not sure if anybody's typing, but happy to take that back if there's more information or respond separately.
All right. Is there an age limit for ABA therapy within ACD? And does this include adults with permanent dependency for retirees?
There is no age limit, but again, the services must be clinically necessary and appropriate. So when recommending treatment, when the BCBA is recommending a treatment plan, the goal should be written of what is the goal, what's the end state of the goal, what intervention is going to be used, what intensity of services. So it's not there's no limitation to age, but it should be for a clinical purpose. I have seen some adult goals. Let me caveat this. Oftentimes, when I get involved in reviewing treatment plans, it's because um, there is an appeal or a determination that it was not clinical. So my perspective of what I see is often the not approved kind, but there are some adults like in their 20s that I've seen still in the program receiving services. So it's possible for sure.
Okay.
Can I put one more plug in? It's really
Yes.
incumbent on the ABA provider to provide that justification and support about why that's a clinically necessary and appropriate skill. That's all. That's all I wanted to add.
Thank you. Um, There was a comment, an individual's an EFMP family support coordinator who's receiving TRICARE West coverage. They work with families that receive TRICARE West coverage. And so, do you have any suggestions on how to better navigate some of the obstacles regarding processing referrals to complete all documentations within a reasonable time? Do you have just any suggestions or recommendations again for that family support coordinator?
I would love to see an example of what you might be referencing. I think there's so many potential pieces and things that come to mind are is it a provider who knows what they're supposed to submit? I've seen providers submit things without signing documents. So I think it could be any number of reasons that would cause a delay. And then I do I don't know if this is coming from a private sector or an MTF, but the genesis translating of the referral to the contractors. I know there were some issues there, so I'm if I would be happy to follow up if you want to either send me directly or send to that ACD mailbox some examples. I can certainly take them and help either figure out or get to the bottom of what the issue might be. But I would, worst case scenario, if there's no forward progress, email the ACD mailbox and I can take it to the TRICARE Health Plan team who has oversight over the referrals piece of the program.
Thank you.
Mhm.
Can the AC, can the ACN help with a child on a wait list for ABA that is PCSing? So can they be waiting on the wait list before they arrive at their new location and have less of a gap in care?
That is a great and hopefully not as complicated answer as I think I'm about to give. So the ASN is really facilitating that transfer of the existing referral of the existing treatment plan to help work with the incoming contractor to identify an available provider. Um, I strongly encourage families that if you have providers tell you about wait lists, your next, as soon as you hang up the call with that provider, you call the contractor back because we are working really hard to really not have the word wait list, but to minimize the amount of time, especially during a PCS, minimize the amount of time between the losing and the gaining ABA provider. Now, to be fair and reasonable, I think the new ABA provider, it is their due diligence, ethical responsibility to do an assessment and not just take over the old treatment plan. There could be a whole host of reasons why that is a good why that is good practice. That might result in some delays. I do want to put in perspective that no gap is probably, I mean, it's the goal, right, to have no gap, but I think a realistic expectation is that you depart your last session and to get established. And remember, the DEERS has to be updated, your enrollment into the contractor has to be updated. So those are some administrative pieces that will naturally cause a gap, but that Autism Services Navigator is really primed to minimize the number of days people are just waiting or have questions or don't know where to go. We are giving that warm handoff so the incoming ASN knows, hey, little Susie's coming and she has established care. She was seeing this level of intensity. Let's find a provider. Let's proactively work to get that identify a provider. Hope that helps. Can you
All
guys
right,
see me?
thank
Oh,
you.
okay.
Yes, sorry. All right, so I've typed a few things in the chat. I just wanted to, since we're getting close to that top of the hour, I did go ahead and type in a comment. Please reach out. I posted my email address in that chat. So if there are more family-specific questions for Dr. Biana, please send me an email and we'll try to facilitate getting you to the necessary individual within TRICARE or DHA that can provide assistance and support since we're kind of sticking with some of the broader questions and comments here. But we do want to make sure that those of you that do have something more specific, we reach out to you. I know with the chat, we get lots of comments, so it might have been hidden. So I reposted a direct link to our PowerPoint slides or Dr. Biana's PowerPoint slides for you to access those resources and any additional information. I'd like at this time to briefly go over how you can get CE credits. I know that's a question that's come up in the slides as well. We're offering several opportunities for CE credits, or those of you that are just needing a general certificate of completion or attendance for documentation. We do have that available. For today's session, we're providing one CE credit. You'll notice that on the slides here, a list of the CE accrediting associations that we're providing. One of the newer ones is the Certified Disability Management Specialists as well. Um, as a putting a question out there for those of you that are providers, if there is a accrediting association that you don't see on this list that you would like for future CE opportunities, post that in the chat. We're always looking for additional CE opportunities to reach out to support you, the providers that are on. And so if you don't see one on here, please let us know. That might be something that we can look into for the future, but I would be curious about that. We're offering CE credits for financial counselors, patient advocates, case managers, again, those disability management specialists as well, family life educators, certified health education specialists. I know those of you that were on, there were several of you looking for that particular CE opportunity. Family consumer sciences, again, personal finance educators, social workers, LPC, LMFTs. We have a unique one here for the state of Michigan, certified teachers, and then just a general certificate of attendance. Um, I appreciate, again, those of you that are posting some additional CEs, so maybe that we can look into the future for those as well. You will need to complete a survey in order to receive that certificate. It'll be automatically generated email certificate as well. Um, and what'll happen is you'll go to our event page. I'll go ahead and post our event page link here into the chat box now, where you can not only download today's presentation slides, but you're going to be able to get CEs for today. You might have to refresh the page, your website if you don't see it, but there will be a section on our event page that says continue education. There's going to be a nice purple button. Um, and that will be available. So give us a few minutes to get that survey link posted or that purple button that's available on our event webpage. But that's where you're going to be able to find our CE information and survey link. And then also, if you have any questions regarding CEs or just TRICARE specific questions, and we can facilitate that conversation between our DHA colleagues. I'm gonna go ahead and post my email address in the chat as well. Send me an email, reach out to me. I'm happy to help in any way that I can. Also, please note, mark your calendar, the month of May is Mental Health Awareness Month. And we are going to be providing a webinar on learning to say no for work-life balance. So this will be very helpful for you, the providers, as you are working to support your military-connected audiences. This webinar is going to be focusing on preventing burnout, managing stress, providing some information on actionable strategies to maintain a healthy work-life balance while meeting your professional responsibilities. So please stay tuned. Mark your calendar for May 21st. At 11 a.m. Eastern Time. I posted that link in that chat to register to join. Also, my very dear colleague Kathleen posted a direct link to the CEs. So those of you that were really looking forward to that direct survey link, Kathleen has posted that link in the chat for you to get as well. Um, we are going to stay on for just a couple of more minutes for you to gather any last minute resources. I did want to just send out a thanks to you, the participants that are on today. Great questions, great comments. I appreciated those of you supporting your colleagues and peers with resources and links in the chat. We really appreciate that. And a big thank you to Dr. Biana for your expertise and your time today in presenting a really important topic area for our providers as they work with families. Um, I will go ahead and post that link again, that direct link to the survey for CEs for you to receive. I know it gets kind of buried within our chat. Again, just a thank you all for joining and attending today. We really appreciated your time. We'll stay on for a couple more minutes so you can gather any resources and links.